Welcome to Coronavirus The Rundown. I'm Usher Qureshi. Each day we showcase how communities are taking on coronavirus, and we break down the big headlines. Today, top leaders testify. Federal Reserve Chair Jerome Powell and Treasury Secretary Steven Mnuchin on the stand about the coronavirus response. They testified to the Senate Banking Committee about coronavirus-related economic stimulus programs. Mnuchin talked about lending programs for local and state governments and for businesses. Powell said the Federal Reserve will continue to use all of its tools to address the crisis. The Trump administration is starting a stockpile of drugs and ingredients for medicines to treat COVID-19. It awarded a 4-year, $354 million contract to Flowcorp to make the ingredients and medicines in Virginia. Many of them currently come from other countries. Flow says its goal is to shore up the supply chain and create a reliable source of high-quality products in the U.S. A new study says surgical masks can reduce coronavirus spread by up to 75%. Researchers from Hong Kong say masks reduced infection rates by up to more than 50% in hamsters. They say their findings show wearing a mask in public can reduce transmission risk. A horrifying experience for one New York family as they watched their young son go into cardiac arrest and had no idea why. Doctors say this is a new complication of COVID-19. Alexa Liaco has the warning from doctors on this bizarre syndrome.
He called mommy, turned to the side, and he never responded back.
It was a moment Roop Hardawar never imagined.
I was there shaking, Jaden, wake up, come on, Jaden.
His 8-year-old son, Jaden, laying lifeless in bed.
It was more emotional because I was thinking more like of the father. I'm losing this kid right now.
The couple's 15-year-old son rushed to help, delivering CPR he just learned in Boy Scouts days before. Minutes later, little Jaden gasped for air.
His pulse, his heart rate came back.
Paramedics arrived and rushed Jaden to Cohen Children's Medical Center. The second grader was put on a ventilator for 3 days as doctors tried to figure out what caused his cardiac arrest. After 4 negative COVID-19 tests,
the 5th test was an antibody test that they did, and that test came back positive.
But Jaden's case was bizarre. He had a fever, but no other symptoms. His entire family tested negative for the virus as well.
We were confident that he couldn't be infected in any way.
Hardawar's doctor says the boy's reaction is part of a growing trend in young people who had COVID-19.
What we call a post-infectious inflammatory response, where it's now a response to a previous infection that the immune system is kind of overactive.
Doctors say they're seeing both children and teens' immune systems working hard long after the virus is no longer a threat.
Some kids have very direct effect of the heart, and it can lead to cardiac arrest. Persistent fever for 3 to 4 days at least, vomiting, diarrhea, belly pain, and those are the most common things. It's not uncommon to see rashes along over the body, maybe red eyes, red cracked lips.
For 13 days, Jaden was in the hospital fighting a fever and inflammation.
Thank you, Jay.
Now the young Cub Scout is home.
Let's go, ladies and gentlemen.
Slowly recovering, eager to get back to his favorite hobby.
He's a rock collector.
For his father, this shocking diagnosis, an emotional lesson.
The virus is not just for older people, it's impacting kids.
But experts want to remind parents this reaction is rare. Treatments do work, and
time does matter. The sooner that they're evaluated, the sooner they're treated, the better off they're likely going to be.
I'm Alexa Liaco reporting.
Doctors are learning more about the transmission of coronavirus. British researchers say there are early signs that children may not spread the virus as much as adults. That's not usually the case with most respiratory viruses. They also believe children are less likely to become infected, but more studies are needed. Dozens of companies are calling on world leaders to align economic aid and recovery efforts with climate efforts. Adobe and H&M are just some of the companies that signed the letter. The goal is to limit the global temperature rise to 1.5 degrees Celsius. They also want to reach net zero emissions before the year 2050. The UN Secretary General said creating a sustainable future is just one thing that will help with coronavirus recovery. Wildland firefighters are gearing up for peak fire season in some places. Kai Beach shows us how coronavirus is changing safety guidelines.
It's a dynamic, obviously, we've never handled.
When it comes to wildland fires this summer, it's not a matter of if, but rather when they'll ignite.
Our job is to protect life and property in those two orders.
Mike Mueller is the Deputy Director of the California Department of Forestry and Fire Protection, the second largest fire department in the United States. With 10,000 employees covering more than 33,000 acres, CAL FIRE is now facing new challenges on the front lines, protecting themselves and the public during the COVID-19 pandemic.
A large fire would have 6,000 firefighters in a base camp. If we're still under this social distancing type of orders, we've got to look at how big. We're going to have to spread that out over a much larger area.
And this increase in new safety measures is spreading across the country.
The public will definitely see a different response to wildland firefighting this year because of the pandemic.
Jessica Gardetto is with the Interagency Fire Center, which manages about 15,000 wildland firefighters and multiple agencies, including the U.S. Forest Service and Bureau of Land Management. She says the biggest challenge is practicing social distancing in a profession that requires close contact.
So we're looking at doing things like having fire crews operate as one unit, like a family unit, like families have been doing during this outbreak and pandemic.
I copy. Break.
Because unfortunately, if one firefighter comes down with COVID-19, then the rest of the group can easily contact it.
In an effort to stop the spread of COVID-19, firefighters will now spend more time disinfecting shared tools and equipment. They'll also wear masks more often. And with 80% of fires started by people, first responders are asking the public to be extra careful this summer.
With COVID, we need the public to be our partner too and be our heroes.
Mueller says when it comes to protection during this pandemic, fire departments will learn by doing. But they also need your help, asking Americans not to get crisis fatigue.
And people don't want to hear anymore about, having to leave their home or quarantine. And that's what we're saying is we will work with you to keep that positive attitude. What we really need now is a call to action.
I'm Kai Beach reporting.
Sales are booming at Walmart. How what people are buying has drastically changed over the last few months. And the common foods and plants that can boost your immune system. Next.
.com.
More people are paying attention to their immune system right now and the role it plays in staying healthy. Sharona Thompson is a certified herbalist in Denver. She teaches the benefits of using herbs and plants to stay healthy. She says it's easy to go the extra mile.
But if you feel like you need to actually boost that immune system, there's a lot of plants that people have been using for millennia that our ancestors have used to keep themselves strong.
She says there are some easy ways to achieve that boost, which include making a daily tea out of holy basil or nettle. People can also boost their immunities without buying expensive, fancy products. Thompson says some grocery store staples are stars for immune health.
Garlic is a prized medicine. It's an antiviral, and it actually thins the blood, and it helps with circulation. Ginger is another one, and that's pretty inexpensive.
She says thyme and horseradish are also great for immune health and recommends a plant most know as an obnoxious weed.
Dandelion is excellent for the liver, and sometimes when our liver is off, it cleanses the blood. It really can upset the balance. So I've been eating my dandelion's root, leaf, and flower, and putting those in tea.
An important warning, don't pick dandelions from the roadside or pesticide-sprayed yards. Another perk of plants and herbs, especially for Thompson, is the stress relief from growing them.
No matter if society's a little crazy right now, I know the plants are always consistent for me. And if I need to get out there to get grounded again, I'll go out and weed. I'll go out there and see the changes with my plants.
Some herbs and plants can impact blood pressure and interact with prescription drugs, so it's important to talk to a doctor before taking anything. We're hearing from the front lines of ground zero for the coronavirus, a woman who went to New York knowing she would be taking care of the sickest patients, many that never got better. But as Maya Rodriguez shares, her story is also hopeful.
We were watching the numbers at home, 700 deaths today, 750 deaths today, 800 deaths today, and we just kept watching the toll from at home, and it was heartbreaking. And I just kind of thought and prayed about it, and I just kept feeling this nudge from a spiritual angle that said, you're needed, go.
Nurse practitioner Lindsay Hetrick left her home, her wife, and 3 children in Panama City, Florida, to spend 2 weeks in the coronavirus, working the night shift in the ICU of a Manhattan hospital.
I expected it to just be, patients in the hallways and patients in the stairwells and patients outside and just absolute chaos. And not to say it wasn't chaos when I got there, it absolutely was. But the nurses in New York were phenomenal.
She's part of a group of hundreds of volunteer nurses from all over the country.
None of us knew each other before any of this, but 2 a.m. every morning we would meet and eat and decompress and vent and laugh and cry.
She says the agency that took care of them and New Yorkers were equally as caring.
They spoiled us so much. They checked on us all the time. They had therapy dogs in the hotel.
Even on the ride to and from the hospital, they felt appreciated.
Every night when we got on the bus, to every single nurse that got on the bus, how are you, honey? Did you get sleep? I hope you have a good night. Please stay safe. And he was one of the biggest encouragers the whole time, the bus driver.
Disasters are no stranger to Lindsay. She spent 5 days straight inside a Panama City hospital that eventually lost its plumbing and had to be evacuated after Hurricane Michael.
Everybody just kind of comes together and you get through it, you go into survival mode.
The hurricane perhaps part of a larger plan for Lindsay that she didn't realize at the time.
It's funny, I remember saying to myself when all of that happened, if I ever have the chance to give this back to a nurse that needs to go home and take care of their families, I'll do it. We're not heroes, we're just nurses and we're tired, so give us some love.
I'm Maya Rodriguez reporting.
As people continue to stock up on supplies, Walmart is seeing a high volume of sales. The chain reports a 74% increase in online sales in the first quarter. In-store sales surged about 10%. Walmart CEO says during the first surge, a lot of customers were buying canned food and paper towels. Later, they started buying a lot of puzzles, video games, and workout equipment. And in the latest wave, many shoppers started buying clothes and TVs, likely an effect from the stimulus money sent out. In order to maintain social distance between passengers, Delta is announcing it will add more flights. The airline says it wants to make sure flights are only up to 60% full through July. The House Transportation and Infrastructure Committee has urged airlines to maintain at least one seat between all passengers. Well, coronavirus derailed a California man's business plans, then presented him with new ones. Vanessa Paz shows us how his idea became a nationwide hit.
It's Washington.
Yay!
War of 1812.
For Ryan Kuhn, founder, owner, and host of Switchboard, it's always been fun and games.
We've been throwing events, what we call social entertainment events, in San Diego for about 5 years. And up until recently, most of those were in-person events where people could interact face-to-face.
But as the swell of closures came, his business, which wasn't so distant-friendly, was the first to break.
All of our events that we had spent months setting up were all canceled within about 48 hours, completely understandably, of course.
But not for long.
We started reaching out to friends, family, say we have this idea. We want to try it out. We did a lot of beta tests.
3 weeks later, all of those canceled events were put back on thanks to the now very popular webcam service Zoom.
I was so worried with everyone saying Boston. I was like...
Before this, he was mostly bringing tenants together in various apartment complexes. But thanks to word of mouth, he's now connecting groups of friends, family, and coworkers.
So you're all winners no matter what. You got something.
Who either want to dive into some trivia or perhaps karaoke, stand-up comedy, or charades. You name the activity and Switchboard probably has it. Ryan's one of 5 hosts and coordinates the entire thing while helping kick off the fun.
There's been a lot of blessings that have come out of this situation. Now we can work with people nationwide, whereas before it was only in San Diego. So we're connecting families who haven't all seen each other at the same time. The thing that we're going through, the growing pains, the learning, the changes, the chaos that we're going through. And at the end of the day, we're connecting people when they really need it.
Proving his company only hit the pause button and it was never game over.
Mothers are connecting to social media to help each other out. Amy Weisberger Stern created a Moms Club group on Facebook years before the pandemic started. But when the health crisis hit, it became a resource for moms who needed a helping hand. The group has helped by donating food and face coverings. It has also held live meetings with doctors about staying healthy.
It was kind of like a news source and then kind of a friend source, and it was having that virtual friends that you'll be able to reach out to.
The group has also provided entertainment for kids by hosting story time with Disney characters. Well, the cheap gas prices we've seen are slowly creeping back up. How long experts think the prices will last. Gas prices have been remarkably cheap over the past few weeks, but we're slowly starting to see them increase. Lindsay Boach looks at how long these low gas prices will last.
If you ventured out of your house in the past few weeks, you've likely noticed how cheap gas prices are. In fact, more than 75% of gas stations across the country have gas for less than $1.99 a gallon. AAA spokesperson Jeanette Castellano says gas prices are so low right now for 2 reasons: crude oil prices and demand.
Typically, crude oil and demand are very high this time of year. Though, given what's happening with COVID-19 and stay-at-home restrictions and limitations, both are extremely low.
She says crude oil is typically $50 to $70 a barrel. Right now, it's about $20. And as those home orders are lifted and businesses start reopening again, there will likely be an increase in demand.
Those states that are seeing fluctuation and increases, those are mostly states where you're seeing more businesses opening, social distancing recommendations still in line, but, more businesses opening and people venturing out.
Like in the Great Lakes region and the South and Southeast. Castellano says the price for gas and how fast it rises will depend on demand, but she doesn't expect the prices to make a dramatic jump.
In the past few weeks, they've been about 5 million barrels a day. This time of year is typically high 9 million barrels a day, and only increasing because it's summer and Memorial Day is around the corner and people are going to take their road trips.
She says the national average is still $1 cheaper than it was this time a year ago, and she doesn't expect to completely close that gap anytime soon. I'm Lindsay Boach reporting.
Well, it's Ramadan, the holiest month on the Islamic calendar. We'll show you how Muslims are using this time to help their communities.
Keller, right now.
Welcome back. Each day we like to end the rundown by highlighting the good going on. Ramadan is the holiest month on the Islamic calendar, and now Muslims are using this time to help their communities. One group, Muslims Giving Back, says it noticed volunteers were concerned about coming out to give out free meals due to social distancing. But they have managed to not only bring in volunteers, but also more people in need. In fact, the group is now handing out about 300 meals a day in New York.
Well, one big family. It doesn't matter if you're Muslim or not Muslim. In fact, the majority of people that we do help out are not even Muslim.
Muslims Giving Back says it's not just giving to people who are part of the Muslim community, but the homeless and anyone else in need. Well, that's all the time we have today for Coronavirus, The Rundown. We'll see you next time. I'm Usher Qureshi. Thanks for joining us.